Dubai has an excellent healthcare system with a large number of public and private hospitals and clinics offering state-of-the-art medical technology and the highest standards of medical care. The government has invested heavily in the health sector and has recently implemented a major project to create Dubai Healthcare City, intended to become a regional centre of excellence for medical services, education and research. To tell us more about Dubai's healthcare system, today we're joined by Mr. Advet Bombani, the CEO of Lifeline Healthcare. Thanks for joining us.
Pleasure to be here.
Now, as we just mentioned, Dubai is striving to become a top destination for medical care. So how close are we to achieving this goal?
I think Dubai is well on its way. With the establishment of Dubai Healthcare City, I think is a visionary and excellent project that's been introduced by the Dubai government. And with a lot of key players from the international arena coming into Dubai, I think that we're well on our way.
Great news. Now, what challenges is the medical industry facing, particularly in the current economic climate?
I think there's a few challenges, although the healthcare industry is far more resilient, I think, than the realty and the financial sectors. But we are having problems in terms of access to capital for expansion projects or procurement of new facilities. I think that's the largest challenge. Although everybody recognizes there's an enormous opportunity in healthcare in the UAE market, I think access to capital would be the number one problem.
Now, of course, the government here is becoming a lot more involved in ensuring that Dubai's healthcare facilities are first class. What do you think their biggest focus needs to be?
I think Dubai Health Authority, which is a newly established organization, I think really has its focus on setting up facilities, emergency and trauma cases, child and maternity hospitals in key geographic areas in the ever-expanding Dubai region. And I think with the trauma center coming up in the Jebel Ali area and such initiatives, I think we're on the right track.
Now, speaking of new projects, Healthcare City is one exciting new project here in Dubai, combining medical facilities, evaluation and research. What does it mean for the industry here and just for normal people living here?
I think it's a couple of things. Firstly, the introduction of an educational and research wing, I think is great, because that's something that's been in very early nascent stages so far in Dubai. But bringing in places like Harvard, Medical International, I think those things will add enormous value and bring in great best of practices into the healthcare city. For the normal consumer, I think it just provides larger choice with a lot of, I think the first phase being pretty much sold out. So there's a lot of new players that have come into the market. I think it just creates more choice for the consumer.
So fantastic. Now, of course, the UAE mainly imports their pharmaceutical products. Do you think we need to start manufacturing these medicines here in order to stay on top of the game?
I think that, like I said, with the research arm coming in, I think in pharmaceuticals and biomedical, I think that those things will definitely enhance, the introduction of new drugs from the Dubai healthcare fraternity. But right now, there's a lot of latent manufacturing capacity in developing nations like India and China, which is still not fully utilized. So, when the patent expires and generic drugs come to the market, I think there's still a lot of cheap manufacturing capabilities that's underutilized. So I think that's something that could be looked down the line, although there are companies that are doing it locally, and it's something that would help, because there are often instances where there's shortages in medicines and vaccinations in the market that are much needed. So definitely having a local manufacturing base would help in that area.
So an interesting future there. Now, how are medical staff sourced, mainly locally or internationally? And what sort of processes do they have to go through in order to obtain a license?
Most of the staff are imported. Most of them are sourced internationally. Of course, there's a little bit of local headhunting that goes on, as it does in every industry. But most of the doctors and nurses are really sourced internationally. I think which is a challenge, really, because having local medical colleges that really churn out these things, keeps the cost low. And because this is something that eventually trickles down to the consumer, because of the fact that we need to bring them in here, and they need to go through a licensing process, which involves either a verbal or written interview, depending if it's a Ministry of Health exam or a Department of Health exam. I think that really, and then also the cost of Dubai have traditionally been pretty high. So the salary levels have been high. So which is a little bit of a challenge when we are competing in terms of, for example, medical tourism with countries where the cost advantage is very good. For example, like India and Thailand and Singapore, where they're able to do the surgeries at a far lower cost than Dubai. I think if we want to be competitive in medical tourism, then we really need to work and see how to get these costs lower.
Now, of course, you're actively involved with Lifeline Healthcare. You've now developed boutique clinics, hospitals, and 800 Doctor. Tell us a little bit about its success.
Lifeline Healthcare actually has enjoyed fabulous success since its inception, with double-digit growth almost every year. And Jebel Ali Hospital, which is the first boutique hospital in the United Arab Emirates, was introduced by Lifeline Healthcare, has had a fabulous response. The idea of a boutique hospital is based on the premise that consumers find large hospitals intimidating. The number of beds really is not really a criteria by which hospitals should be judged anymore because of the advances in surgeries, with them being minimally invasive. Most of the surgeries now are day cases or are discharged within 24 to 48 hours. So what really is important for a hospital to focus on is advanced equipment, advanced surgical practices, and bringing in that talent that can really ensure minimal complications, infection control. And I think that's what is really important. So the boutique hospital really focuses on, it's very patient-centric. I mean, you come in, it's ideally 50 beds, not very large. So it's perfect fit between a clinic and a large hospital where you have the warm ambiance. It's really a merger of hospitality industry and healthcare, where you have the warm ambience and the hospitality coming in, matched with clinical excellence and patient care.
Really focusing on the patient there. Mm-hmm. Well, Mr. Advait Vumbani, CEO of Lifeline Healthcare, thank you so much for your time today. It's been a pleasure.
So much.
Well, that's it for this edition of Inside Business. Of course, you can contact us by writing to ib@studio7tv.com. We'd love to hear your questions or comments. You can also follow what's happening on the program via Twitter. It's inside_business. For now, from all of us on the business desk, goodbye and thanks for watching.